Welcome back to my channel. If you're new here, I'm Nurse Alyssa, a wound care specialist dedicated to helping you understand and manage all things wound related. Today, we're covering a topic that's absolutely essential in wound care: chronic wounds. What they are, the type, and most importantly, how to start treating them. Here's a truth that most people don't know. You can't heal a chronic wound until you correct the underlying cause. You can clean it, you can dress it, you can even use fancy products, but if the root problem isn't fixed, that wound is staying open. What is a chronic wound? A chronic wound is any wound that doesn't follow the normal healing process, and it stays open for more than 4 to 6 weeks. These wounds are common in people with diabetes, circulation problems, or who are bedridden, and they are a major source of pain and infection risk. Types of chronic wounds and how to correct the cause. First up is pressure ulcers. Pressure ulcers, also known as bed sores, happens when consistent pressure on the skin cuts off the blood flow, especially over bony areas. To correct the cause, you must reduce and redistribute pressure using turning schedules, support surfaces like pressure relieving mattresses, and proper positioning. Diabetic foot ulcers. These ulcers form on the feet of people with diabetes, often due to nerve damage and poor circulation. To correct the cause, you must offload pressure from the foot using specialized footwear or total contact casting, and optimize blood sugar control to improve healing. Venous leg ulcers. Caused by chronic venous insufficiency, these ulcers often appear near the ankles and come with swelling and a whole lot of drainage. To correct the cause, you must improve venous return using compression therapy like multi-layer wraps or compression stockings, and elevating the legs when possible. Arterial ulcers. These result from poor arterial blood flow, often painful, and located on the legs, feet, or toes. To correct the cause, you must restore blood flow through vascular evaluations, sometimes needing surgical revascularization or angioplast. In cases of arterial ulcers, you must avoid compression therapy. That is why proper diagnosis is an absolute must. As you can see, the two most common leg ulcers are completely opposite, due to one having involvement of the arteries and one having involvement of the venous system that returns the blood flow. To correctly determine the type of ulcer that you have, an ankle brachial pulse index is performed. Mixed arterial and venous ulcers. Of course, it's not just as easy as being a venous or arterial ulcer. Sometimes you can have mixed etiologies, including both the arterial and venous system, and they're really tricky to treat. So to correct the cause, you must first assess vascular status. Then you use modified compression if tolerated. So you need to be managing both systems very cautiously. And this usually involves a vascular surgeon to help manage these ulcers. Malignant or fungating wounds. These wounds develop when cancer invades the skin, like advanced breast or head and neck cancers. To correct the cause, you need to treat the underlying cancer, if possible, with palliative radiation, chemotherapy, or surgery. Then you're going to focus on symptoms like pain control, odor, and bleeding. Traumatic chronic wounds. An injury that doesn't heal becomes chronic, often because of poor circulation or repeated trauma. There's normally an underlying cause not allowing the wound to heal. So to correct the cause, you must first protect the area from further trauma, improve blood flow to the area, and treat infection or underlying comorbidities such as diabetes. Infected wounds and chronic infections. Infections, especially with biofilms or bone involvement, can keep a wound open for months. To correct the cause, you must control infection with debridement, appropriate antibiotics, and wound hygiene. You also want to test and treat underlying osteomyelitis if present. Surgical wounds that fail to heal. When surgical wounds reopen or become infected, healing halts, often due to poor tissue perfusion or tension to the area. To correct the cause, you must relieve tension, treat infection, and optimize nutrition and systematic factors like blood sugar and blood flow. Here's the big takeaway. Wound care is just never about the wound. It's about the why behind it. If you don't fix the cause, you will not heal the wound. I hope you found this video helpful. If you did, please hit the like button and don't forget to drop a comment down below with your questions or topics that you would like to see an upcoming video on. But that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.